Steritite Instructions for use. Steritite, the container system of choice. The Steritite rigid container system is available for both pre-vacuum and gravity displacement sterilizers. The perforated bottom containers can also be used with pre-vacuum sterilizers. Pre-vacuum containers with solid bottom cannot be used in gravity displacement sterilizers. The perforated bottom containers have also been validated for STERRAD sterilization. Whenever a new packaging method is introduced into a healthcare facility, all procedures associated with its use should be carefully evaluated and adapted. Steritite decontamination. Disassemble all components. Unlatch and remove the lid of the Steritite rigid container. Inspect the gasket in the lid for accurate fit and undamaged surface. There is no reason to remove the gasket for the cleaning procedure. Remove the tray of instruments and prepare the instruments for decontamination following the recommendations of the instrument manufacturer. Remove the filter retention plate or plates by turning the handle of the locking mechanism clockwise. Inspect the gaskets in each filter plate. Place the filter retention plate in a basket for cleaning. Please note, Steritite pre-vacuum containers have filters in their lid. The Steritite container with vented base has filters in both the lid and base. Remove filter or filters and discard. Filters installed on delivery are not meant for the sterilization process. Filters are disposable and limited to single use only. The Steritite container components should be cleaned in an automatic washer decontaminator. Always use a pH-neutral detergent and follow the washer manufacturer's instructions concerning correct use and secure positioning of the items. Caution! Do not use alkaline detergents, as they will oxidize the aluminum of the container. If necessary, you may clean Steritite container components manually with a soft cloth and a pH-neutral detergent. Make sure to remove all detergent agent with a thorough rinsing. Detergent residues can affect coloration and the appearance of the container's surface. Try to avoid water collections by washing and drying the container upside down. Use a soft cloth to dry all components of the container. Steritite assembly for use. Recommended inspection criteria. Verify that gaskets in the lid and in the filter retention plate or plates are pliable, without cracks or tears, and that they are all properly and firmly affixed. If the retention plate is loose, adjust the tension by pressing downward along the perimeter of the plate. Verify that the filter retention post or posts in the lid and label holders on the front of the Steritite container are secure. The recommended inspection criteria should be performed after each use because of the variables associated with cleaning agents and equipment. For Steritite perforated bottom container, place a circular filter over the perforations in the base of the Steritite container and place the filter retention plate over the filter. Secure the filter retention plate by pushing downwards at center point, where indicated, and rotate the handle counterclockwise to close. Arrange the clean instruments in the basket or baskets according to hospital procedures following the recommendations provided by the instrument manufacturer. Metatray partitions, brackets, and posts are recommended for easy loading and unloading as well as protection of your delicate instruments. Place the prepared baskets into the base of the Steritite container. Place a chemical indicator in the corner of the instrument basket. Place a circular filter over the perforations in the lid of the Steritite container and place the filter retention plate over the filter. Secure the filter retention plate by pushing downwards at center point, where indicated, and rotate the handle counterclockwise to close. Please note, use SCFO1 cellulosic filter for steam sterilization. Use SCFO2 polypropylene filter for STERRAD sterilization. Place the lid on the top of the base. Secure secure the closure by latching the lid to the base. The top of the latch fits over the ridge in the lid. Push the bottom section of the latch over the lock holder. You will feel a solid click. Place the appropriate metal ID tags in the label holders located to either side of the container latches. The label holder on the right can accommodate a load card available from Case Medical Incorporated. Thread the guide on the Steritite tamper evidence seal through the lock holder and secure. Repeat on both latches. An external indicator should be attached to the container at this time. Place the Steritite container flat on the shelf of the sterilizer cart. If needed, up to 3 containers may be stacked and processed in an autoclave. Consult the recommendations of your sterilizer manufacturer in order to determine the correct parameters regarding temperature, weight load, dry time, instrument processing, and pre- and post-conditioning cycles. Caution: use of the Steritite container in gravity displacement steam may increase exposure time. Following the sterilization process, the cart should be removed from the sterilizer and placed in cool down for a minimum of 20 minutes to minimize the potential of condensate formation within the container. Steritite at point of use. Before opening the Steritite container, always verify the tamper evidence seals are intact, the acceptability of the endpoint response of the external chemical indicator, that the correct set has been selected. Break open the seals, remove, and discard. Unlatch the container. Remove the lid using the rings on the top of the lid to avoid contaminating the contents of the container. The scrub person will check the endpoint response of the chemical indicator to verify acceptable endpoint response. The scrub person will then remove the basket of instruments and place it in the sterile field. Please note, at the completion of the procedure, the Steritite container can be used to contain and transport contaminated instruments to the decontamination area. Case Medical recommends Steritite containers sterilized in an outside contract facility should be